Hypersensitivity reactions.
Hypersensitivity reactions. Hypersensitivity reactions are exaggerated immunological response which occur in response to an antigen or allergen. Hypersensitivity reactions are of four types: type 1, type 2, type 3, and type 4. The type 1, type 2, type 3 are known as immediate hypersensitivity reactions because they occur within seconds to minutes of exposure to the antigen or allergen. Type 4 hypersensitivity reaction is a delayed hypersensitivity reaction as it occurs after 24 to 48 hours. The immediate hypersensitivity reactions are predominantly mediated by IgE, IgM, and IgG antibodies. The delayed hypersensitivity reaction, however, is cell mediated. Type 1 hypersensitivity reactions. The type 1 hypersensitivity reactions occur as a result of exposure to an antigen. The response to the antigen occur in two stages. First is the sensitization stage, and then there is a effect stage. In the sensitization stage, the host experiences an asymptomatic contact with the antigen, which means because of contact with the antigen, there will be production of antibody, but there is no symptoms in the patient. However, in the effect period, the pre-sensitized host is reintroduced to the antigen, which then leads to type 1 hypersensitivity reaction, which could be anaphylactic or atopic immune response. These responses are mediated by IgE antibodies, which are also known as reagent antibodies. They are produced by the immune system in response to environmental allergens such as pollens, animal danders, or dust mites. These IgE antibodies bind to the mast cells and the basophils, which contain histamine, serotonin, and 5-hydroxytryptamine granules, which are released then in the reaction, and these cause inflammation. The type 1 hypersensitivity reactions can be seen in bronchial asthma, allergic rhinitis, allergic dermatitis, food allergy, allergic conjunctivitis, and anaphylactic shock. Anaphylaxis is a medical emergency as it can lead to acute life-threatening respiratory failure. It is an IgE mediated process. It is the most severe form of an allergic reaction in which mast cells suddenly release a large amount of histamine and later leukotrienes. In severe cases, intense bronchospasm, laryngeal edema, cyanosis, hypotension, and shock are present. Type 2 hypersensitivity reactions. These reactions are mediated by IgG and IgM antibodies. The immunoglobulins involved cause damage of the cell by activating the complement system or by phagocytosis. It can be seen in immune thrombocytopenia, autoimmune hemolytic anemia, and autoimmune neutropenia. Type 3 hypersensitivity reactions. These are also mediated by IgM and IgG antibodies, which react with soluble antigens and form antigen antibody complexes. The complement system becomes activated and it releases chemotactic agents that attracts neutrophil and causes inflammation as tissue damage as seen in vasculitis and glomerulonephritis. Type 3 hypersensitivity reactions can classically be seen in serum sickness and Earth's reaction. Serum sickness can be induced with massive injections of a foreign antigen. The circulating immune complexes infiltrate the blood vessels and tissues and cause an increased vascular permeability, which leads to inflammatory process such as vasculitis and arthritis. Serum sickness was a complication of anti-serum which was prepared in animals to which some individuals produced antibodies. It was also experienced in the treatment with antibiotics such as penicillin. Earth's reaction is a local reaction which is seen when a small quantity of antigen is injected into the skin repeatedly until detectable levels of IgG antibodies are formed. If the same antigen is inoculated, immune complexes develop at the mentioned local site and in the endothelium of small vessels. This reaction is categorized by presence of marked edema and hemorrhage depending on the administered dose of the foreign antigen. Type 4 hypersensitivity reactions, also known as delayed type hypersensitivity reaction, involves T cell antigen interactions that cause activation and cytokine secretion. This type of hypersensitivity reaction requires sensitized lymphocytes which respond within 24 to 48 hours after exposure to soluble antigen. The delayed type hypersensitivity reaction may involve T helper cells or cytotoxic T cells rather than antibodies. The example for type 4 hypersensitivity reactions can be noted in disease like tuberculosis, leprosy, sarcoidosis, and contact dermatitis. In these, there is sustained release of antigen and continued activation of sensitized T cells, which result in amplified tissue damage. Persistent infections may provoke excessive macrophage activation and granulomatous responses, leading to extended fibrosis and necrosis of the tissue.